looking at. I need to get my story straight. My friends are in the bathroom getting higher than the
On
Empire
August
State.
6, 1945, the world experienced one of the most devastating and destructive events in history, the bombing of Hiroshima and Nagasaki.
I know I gave it to you months ago.
The world will note that the first atomic bomb was dropped on Hiroshima, a military base. We won the race of discovery against the Germans. We have used it in order to shorten the agony of war, in order to save the lives of thousands and thousands of young Americans. We shall continue to use it until we completely destroy Japan's power to make war.
Although American lives were spared, Japanese lives were not. The explosion alone killed 80,000 people instantaneously. However, tens of thousands of people would later die of radiation poisoning, and to this day, people still continue to experience the aftermath effects of this deadly nuclear weapon. At the instant of the explosion, people immediately began to experience the effects of radiation poisoning. The moment the bomb went off, it sent out powerful infrared radiation and gamma rays that could penetrate the walls and damage the cells of the human body. In other words, the impact alone did not kill all those people. It was the addition of a high dosage of REMS, the unit used to measure radiation dosages, that was also a large factor in the deaths of thousands. The acronym REM stands for Row Antigen Equivalent in Man. 1 REM represents the amount of radiation needed to cause significant damage to living tissue. In addition, the total amount of REMs a person receives determines how much harm a person will suffer.
Now and then I think of when we were together, like when you said you felt so happy.
At the bombing of Hiroshima and Nagasaki, people not only received a high dosage of REM at the instant of the explosion, but also from fallout. Fallout occurs when radiation particles come falling back to the ground after the powerful impact of the nuclear explosion had lifted them up into the upper atmosphere. Doses below 100 REMs usually have little to no effect besides some detectable changes in blood, which occurs around 25 REMs. However, if one receives a dose of radiation above 100 REMs, they begin to display the first signs of radiation poisoning. These symptoms can include nausea, vomiting, headaches, and a slight decrease in one's white blood cell count. As doses reach higher REMs, radiation poisoning begins to have very harmful effects on the normal functions of most body systems. At 200 REMs or greater, radiation will begin to destroy the cells in the body that divide rapidly. As a result, victims will experience temporary hair loss, immediate damage to nerve cells, small blood vessels, the lining of the intestinal tract, and the reproductive tract cells. In addition, at higher REMs, victims will experience inflammation of the lungs. Radiation poisoning can also have a damaging effect on the bone marrow, the spleen, and the lymph nodes. These organs play a huge part in the body by producing red blood cells, platelets, and white blood cells. These cells are responsible for carrying oxygen, stopping bleeding, and fighting infection respectively. In addition, radioactive iodine can have damaging effects on the thyroid gland. In sufficient amounts, radioactive iodine can destroy the entire thyroid gland. Lastly, radiation exposure can have secondary effects on the urinary system and can cause slight changes to muscle and connective tissue. Thus, victims will experience a feeling of general weakness, anemia, and lower resistance to infection due to the decrease in white and red blood cells. Exposure can also result in a decrease in fertility, or with high levels of exposure, some victims will become sterile. Also, due to damage to parts of the digestive system, a victim will experience impaired secretions of necessary fluids and also failure in food and water absorption, which in turn will lead to dehydration from diarrhea. Lastly, radiation exposure harms the DNA and RNA of surviving cells. Almost half the people die who receive radiation exposure at 450 REMs. Radiation above 800 rems, however, is surely a death sentence. Those who do survive are likely to suffer from leukemia, lung cancer, thyroid cancer, breast cancer, and cancers of other organs. Only a few months after the bombing of Hiroshima and Nagasaki, there was a dramatic increase in the number of leukemia cases. Even fetuses whose mothers were exposed to radiation suffered from deadly cancer as well. Leukemia is a cancer of the blood cells and has a damaging effect on bone marrow, the site where blood cells are produced. Healthy bone marrow will manufacture white blood cells which help fight infection, platelets which aid in blood clotting, and red blood cells which transport oxygen to different parts within the body. In contrast, when a victim suffers from leukemia, their bone marrow produces abnormal white blood cells. These abnormal cells grow at a very fast rate and do not stop growing when they should. This soon becomes a problem because these abnormal cells crowd out the normal blood cells, which in turn can lead to anemia, bleeding, and infection. Signs and symptoms of leukemia include fever and night sweats, headaches, bruising or bleeding easily, bone or joint pain, a swollen or painful belly from an enlarged spleen, swollen lymph nodes in the armpit, neck, or groin, getting a lot of infections, feeling very tired or weak, and losing weight and loss of appetite. When diagnosing for leukemia, one's doctor will ask questions in regards to previous health history and look for these signs and symptoms. In addition, while performing a physical exam, it is not uncommon for a doctor to look to see if the patient's lymph nodes are swollen or their spleen is swollen. If there are indications of leukemia, a doctor will order blood tests that look for an abnormally high or low white blood cell count. However, the best test for leukemia is a bone marrow biopsy, which usually occurs after a blood test signifies something is wrong. Treatment depends on the type of leukemia one has. For acute leukemia cases, one will need quick treatment to prevent the rapid growth of leukemia cells. However, patients with chronic leukemia can rarely be cured, but rather, doctors focus on doing all they can to control the disease. There are many different methods of treatment for leukemia. The main treatment method is chemotherapy, which uses powerful medicines that kill cancer cells. In addition, radiation treatment is also used to kill cancer cells, but it can also be used to shrink swollen lymph nodes and enlarge spleens. However, if more treatment is needed, patients will undergo stem cell treatment after radiation treatment. These new stem cells aid in rebuilding your normal supply of blood cells and, in addition, help boost your immune system. Lastly, another type of treatment is biological therapy, which uses special medicines to improve your body's ability to defend itself against cancerous cells. In general, 42% of people survive about 5 years after being diagnosed with leukemia. However, survival rates are higher among children than adults. It is estimated that 4 out of 5 children will survive these 5 years, whereas only 25 to 35% of adults are predicted to survive this long. In addition, 80% of patients suffering from acute myelogenous leukemia who undergo treatment will go into remission after 1 month of treatment. Also, patients with chronic lymphocytic leukemia who have undergone treatment will survive an estimated 9 years, although some have survived longer. However, people with CLL are more likely to relapse. Lastly, predicted survival times for patients with chronic myelogenous leukemia depend on age. Those under 40 years old live an average of about 3 years or more if they have received a transplant. However, without this transplant, survival chances are decreased. Although leukemia primarily affects the blood, it also plays a role in both the lymphatic and skeletal system. One of the main functions of the skeletal system is to produce blood cells, which includes white blood cells which leukemia affects. Because abnormal cells are being produced, they begin to crowd out the other normal blood cells, which can cause profuse bleeding. In addition, because abnormal white blood cells are crowding out the normal cells, the body's lymphatic system, our body's main defense system, is left defenseless and is more prone to infections. Because leukemia is neither contagious nor, as far as we know, hereditary, there is no way to further decrease this outbreak of disease other than to make sure this horrific event does not occur again. Only time will help here, as it has already done. As of now, the number of leukemia cases has decreased drastically since after the bombing of Hiroshima and Nagasaki. Life has finally returned to normal for the Japanese people. However, a trace of this tragic event will continue to live on inside the bodies of those who were present that terrible day.